Hi, I'm Michael Lawson. I am a board-certified internal medicine physician in Minneapolis, Minnesota, working as a hospitalist. Today I wanted to talk a little bit and go into a little bit more depth about why physicians are so excited about the Pfizer vaccine. So I want to get past the soundbite culture level of understanding and just go into a tiny amount of depth as to when a physician reads the study that was published in the New England Journal of Medicine on December 10th, why we're excited about this, why this study demonstrates that this vaccine by Pfizer is both safe and effective. So let's talk about it. I had planned to actually share the images on this video. However, I'm finding out when asking for permission from the New England Journal website, they're gonna charge me $150 per image. I care about your education. I do not care that much. So instead, I'll link below to the freely downloadable PDF for your own viewing. We're not going to be delving into the immunology behind the vaccine itself, other than to just say this is an mRNA vaccine that allows your own cellular machinery to produce the spike protein of the SARS-CoV-2 virus, which is the virus that causes COVID-19. This allows your own immune system to recognize the SARS-CoV-2 virus by these spike proteins and eliminate it. I will also link to a really nice overview video by JAMA, which is the Journal of the American Medical Association, which is a highly respected journal. That video does a really nice job overviewing a lot of the new vaccine technologies that are coming our way very shortly. But for this video, I just want to simply talk about how I think about and appraise these sorts of articles and journals. In my training, I was taught critical appraisal. This is a method by which physicians break down the medical literature, figuring out what the study is telling us, to critique the study even if we don't have a significant background in medical research, and to help us figure out whether or not we should incorporate the findings of the study into our clinical practice. First, we just have to ask ourselves, what's the study question? Is the vaccine safe and effective? That's it. That's a good study question. That's what I care about, and I'm sure that's what you care about. Question 2 is, well, what is the study design? When researchers are designing medical studies, there's a whole host of different tools that they can use. The best study design that we have in existence is what's called a randomized, double-blind, placebo-controlled trial. And that's what this is. So let's break that down a little bit. Randomized means that you don't get to pick whether or not you're going to get the vaccine. You are automatically selected to either enter into the treatment arm, which would be in this case getting the vaccine, or the control arm, getting the placebo. The double-blind part means that both the study participants, the people being injected, and the observers, the people doing the injecting, don't know if they're giving the actual vaccine or placebo. The reason that this type of study is so effective and so highly sought after is because the bigger study you make it, the more both arms of the study look exactly alike. Both arms will be alike in age. Both arms will be alike in gender breakdown. Both arms will be alike in ethnic breakdown. Both arms will be similar in incidence of other diseases like hypertension or high blood pressure, obesity, diabetes. Why this is important is because if you see any difference between the two groups, then you can reasonably assume that that's based on the only variable, which is, in this case, whether you got the vaccine or not. And if we see any difference in the study, this goes to further support that that's because of the vaccine itself and not because there's more diabetics in one arm or more women in one arm. But really, the vaccine is the only variable between both groups. In these studies, they always include a table of the breakdown of the demographics of the study participants. And for this study, it's table 1, breaking it down between the BNT162b2, which is the vaccine, rolls right off the tongue, and the placebo group. As you can see, the breakdown between Male and female is very similar. The breakdown between white in both groups, Black or African American, Asian, Native American or Alaska Native, etc., by ethnicity, by country of origin, and importantly by age. So the most important variable in figuring out if you are going to be severely affected by COVID-19 pneumonia or die from it is your age. There is a clear relationship between mortality or case fatality rate, your chances of dying, and how old you are, with older patients faring much worse. And in this study, we see that those aged 16 to 55 is equally represented in both arms, as is those greater than 55. In fact, over 42% of both arms were over the age of 55. Question 4 is, what are we measuring, and do we care about that measurement? So in the medical literature, this is either going to be called the primary or secondary endpoints. This is what the authors go in saying, hey, this is what we care about and this is what we're going to measure. And the primary endpoint was whether you became infected with COVID. So do we care about that? Yeah, we sure do. That is a good primary endpoint. So question 6 is the findings. What did the study uncover, or what did we find out? The first thing they address is the safety profile. They gave the study participants electronic diaries and then followed any symptoms that they were having for 7 days after both the first and second injection of the vaccine. Then the authors broke these symptoms down into either local effects or systemic effects. Local being at the injection site itself, did it cause problems? Systemic meaning, did you experience whole body symptoms? For the local symptoms, they tracked pain at the injection site, swelling, and redness. The most common local symptom was pain at the injection site for those who actually received the vaccine. In the study participants who were 16 to 55, right around 80% of participants noted pain at the injection site for the first few days. For those over 55, it was less, but still over 2/3 of participants. For redness and swelling, it was about 5 to 7% of study participants who reported those symptoms, kind of regardless of age. And for those who received the placebo, it was roughly 1%. So what am I expecting when I get the vaccine? I'm expecting it's probably gonna hurt for a day or two, and there's a small chance that I might have some redness or swelling in the area. In the majority of patients, this was mild to moderate and resolved within 2 days. For systemic symptoms, they followed fever, fatigue, headache, chills, vomiting, diarrhea, muscle pain, joint pain, and the use of anti-fever or antipyretic medication, Tylenol, ibuprofen. As you can see in the table, there were higher numbers in the vaccine group who experienced fatigue, headache, chills, muscle pain. Okay, so we do see that there is some side effects associated with the vaccine, but fortunately they're very frequently mild to moderate in severity, and they don't last long, a day or two. So Pfizer, the FDA, the CDC, physicians worldwide are looking at this data and saying, okay, we accept this safety profile. This is good news. But it doesn't answer the question, does this prevent people from getting sick with COVID or even getting COVID? And that's where figure 3 comes in. When we talk about the horizontal or x-axis, that's time after the first dose. So this is a 2-dose vaccine that's given 21 days apart. The vertical axis, or the y, is the incidence. How many people are starting to get diagnosed with COVID and at what time after their first dose? Now, we're jump-starting the immune system. So this isn't, we give the vaccine and instantaneously your immune system will recognize and kill COVID-19 on site. It takes time. It takes time for your body to process that, to make the spike proteins, for the spike proteins to be recognized by the immune system. So what we see is about 10 days after the first dose, this is where we start to see the two groups separate. Now, as we've covered with a randomized controlled trial that's double-blinded, any difference we see is going to be due to the treatment itself, in this case, the vaccine. So how I'm interpreting this graph is that about 10 days after your first dose, your immune system is starting to be able to fight off COVID-19. You start to see less and less cases, in the vaccine group, while those who receive the placebo are continuing to be diagnosed with COVID at a steady rate. And this culminates in Table 2, where you have almost 20,000 people in each arm. And in the vaccine arm, you're ending up with fewer than 10 patients diagnosed with COVID-19. And in the placebo group, you have over 160 cases. By doing statistical analysis on this is where that 95% efficacy comes from. And this is why people in medicine are so excited about these results. This is extraordinarily promising. This is my interpretation of the data, and it does not reflect my employer or anyone else's interpretation of the data. My point is to say this: it's good to be skeptical. It's good to ask these questions. But what is not okay is to, despite any degree of convincing evidence, continue to hold to preconceived notions about whether this vaccine is a good thing or whether it's a bad thing. We have to look at the data, we have to look at the study to determine, is it safe and is it effective? And thankfully, in this circumstance, the answer is yes. So I, for one, cannot wait until I get this vaccine. I'm starting to see my friends and colleagues who practice elsewhere in the United States already receiving the vaccine, and we are very excited. This has been an incredibly challenging year to be a healthcare worker, particularly in the hospital setting, and to finally have a bit of good news, a glimpse at the end of the tunnel, is just terribly exciting. Look, I get it. This is complex stuff, and there's so much noise out there, it's hard to know who to believe or what sources to trust. All I would say is that in my assessment, this is an extraordinarily well done study that shows incredibly promising results, and I have no hesitation in being one of the first people to get the vaccine. Hopefully this was helpful. If you have any additional comments, questions, or concerns, feel free to comment, and I will do my best to address those either in the text or in a future video. All right, we'll see you next time. Hopefully by the next video, we'll have Moderna's vaccination study available to kind of compare and contrast and kind of build on some of the concepts we talked about today. Stay safe out there.